Thank you, Chris. Thanks for sharing that, Chris. I don't know about the rest of you, but maybe we should be renaming our session Living Here Longer, Living Here Better. As we shift into the presentations, we do want to remind you that everything that you see presented today is available on the Aging Well Initiative section of the Senior Services website. So don't worry about, trying to capture any specifics. All of the details of the plan and the action steps will be on there, and we will continue to update that website as the plan rolls out. We have noted the complete website address on the bottom of your agenda, I think one of the pages. 18 months ago, our Community Health Service Agency brought the national focus on health into the regional and local focus by undertaking a study of our county's needs. Joining us today to share the details of that work and the results is Liz Stark, Director of our Pitkin County Community Health Services. Liz?
Okay. Might raise this up a bit, maybe. There we go. Hi. I'm Liz Stark. I'm the Director of Community Health Services, and we are the public health agency for Pitkin County. And I'm really happy to be here on this at the Senior Summit and this kickoff of the Aging Well Initiative. It really is a culmination of a lot of work that's taken place already, but it's the kickoff of a lot of more great work that's going to happen in the future. So thank you for being here. I'm here to tell you about public health's role in this whole process, and I also want to tell you a little bit about public health in general first. I want to give you a definition of public health. Public health is the art and science of preventing disease, prolonging health, and promoting life and promoting health. And when I use the word health, I mean health in the big sense of the word, not just the health care that you receive from your doctor or the services you get from your local hospital. I mean health in the big sense of the word. Anything, any factor that influences your quality of life. That's the kind of health that public health is talking about. The public health system has traditionally been known as one official governmental public health agency that does this work. But what we've come to find out is that it really is more than that. It's about other public sector organizations as well as private sector organizations coming together to really address to create the public health system. It's any organization and anybody that has an impact on the health of a community. So the role of public health in many communities is to identify and prioritize and address any community or population-wide health problems that are in every community. So as the Public Health Agency for Pitkin County, Community Health Services embarked on a community health assessment, which is required by our state to do this. In 2012, we performed a community health assessment where we looked at data of all the health factors in our community. And then we also created a report or a plan called the Pitkin County Public Health Improvement Plan. And that plan pulled out the top three issues that were concerns for our community, as well as some strategies that we identified to address those problems. So I want to go through a little bit of that process with you and just describe what we did as an organization to get where we are today. So in January of 2012, we convened a steering committee of engaged community partners. These were people that represented different sectors of our community. We had the whole lifespan represented. We had childhood, or people that represented childhood up to older adults, including at Pitkin County Senior Services. We had the schools represented, different aspects of health care like mental health, oral health, environmental health. So it was a really engaged group of people that were committed and met monthly for about 6 months of 2012. And we also interviewed different stakeholders. We looked for people in the community who were serving target populations, maybe hard to reach people like our Hispanic community. We talked to them. We had a community forum. We invited the public to come and look at our data and then have conversations about what they thought the most important health issues were in our community. So we combined some hard quantitative data, the numbers, with the qualitative data, those conversations and things that people said about what they thought was important. Okay. So I just want to share with you some of the data that we looked at. We looked at demographics, the age and gender of our community. We looked at economic factors like income and unemployment rates, health behaviors like smoking, drinking, health conditions like obesity and diabetes and heart disease, health outcomes, like what were our main causes of death, what are our cancer rates, what types of cancer are more prevalent here. We looked at health care, and in this environment of Affordable Care Act and health care reform, this was a big topic, and looked at our uninsured rates and how are people accessing health care services in our community. And we looked at the physical environment. Is our community safe? Do we have access to healthy food? Is it walkable? Can we get around? Can people get around well and easily? There were three data points that really got our attention. You back up just one, I think, hopefully. Yeah, this one. So this data point tells us the percent of our county population by age group and by county compared to Colorado. So it takes these different age groups across the bottom, compares us to Garfield and Eagle County and to the state of Colorado. And as you can see, I think it's a gray line, that age group, 40 to 64, and this is data from 2010, the gray line, where our population in 2010, over 40% of it was in that age group of 40 to 64. So and compared to Garfield and Eagle counties, we were well above them, as well as over the state. So that's our baby boomers. That's the age, that's the group of people who are moving into the 65 and plus age group. So that was significant to us. The next slide. This data point was looking back from 2000 to 2010 and gives us the percent of change in our population of that group that's 65 and older. So Pitkin County circled there in the red. So this graph tells us, and this is from the State Demography Office, that between 2000 and 2010, the 65 and older population grew between 50 and 100%. So we've been growing this population for some time. And the next slide. This one is looking forward, and it tells us the same percent of the population that's 65 and older, that will be 65 and older between 2010 and 2030. And Pitkin is circled there, and although we're not the fastest growing county in the state, we still have a very high rate of increase. We expect to increase that population by 75 to 150%. So those three things really got our attention. We had about 7 other health issues that sort of rose to the top, and we had to apply some other determining factors to sort of figure out how we were going to pick 3. We only wanted 3 to work on over the next 5 years till we do this again. We couldn't do all 7, so we had to apply some other factors to that. Those determining factors included the burden. For example, what kind of a burden will this put on, will these different health issues put on our community, say in terms of, will one of them has a high mortality rate, or is there a large percentage of the population that's affected by that issue? The other one is capacity. We needed to know what our partners could bring to the table, what resources our partners had to work on this, because remember, this is a community, our public health system is a community, it's not just one agency. Not one agency could not do this alone. So we surveyed our partners to find out what resources could you bring to the table for each one of these health issues. The next thing we had to look at was interest and readiness. We had to know that we had partners who were ready and willing to work on this, that there was some interest. Otherwise, we'd all just be fighting an uphill battle and wouldn't get anywhere. So these were our results, our top 3 priorities for Pitkin County, our public health priorities. We know mental health and substance abuse, it's been here a long time, it's not going away, we're committed to continue to work on it. Because of our environment of healthcare reform, healthcare access and access to health services rose to the top. But the needs of our growing older population also rose to the top. It really met all the criteria of our determining factors. We have the burden issue covered. We have a large percentage of the population who's going to be affected just by being the age that they are. We had interest and capacity because Pitkin County Senior Services was ready to launch this community-wide strategic planning initiative with partners. So all the things together made it one of our top priorities. So as Marty said, 1 year ago exactly, the Aging Well Initiative began. I wanted to just share a little personal note with you. Before I joined the Public Health Agency, which was about 7 years ago, I worked at Aspen Valley Hospital, and I started there in the mid-1980s. And as a nurse, I had the privilege of caring for many of our old-timers. And as a young person in my 30s, many of them made a big impression on me. And I enjoyed taking care of them a great deal. 3 women, they just happen to be women, that stand out in my mind were, that I think of often, are Ann Wieben, Frida Glacier, and Trudy Ostermeyer. And those were really pioneer women in our community. And that whole generation of men and women really had strong roots here, and they created a history for our community, for all of us, a really rich history. And I imagine that growing older in that generation was not easy, but we are facing new challenges now, and we have a completely different way of life, which requires a different way to look at it, some different approaches, different systems in order to support us in living well as we get older. The efforts of the Aging Well Initiative really do aim to preserve that ability of each one of us to hold on to our roots and to make those contributions to our community as we get older, and to do it as well as we possibly can. There are a lot of you in that 65 and plus age category already, and there will be many more of us in the near future, according to our data. But the Aging Well Initiative allows us the opportunity to take care of the old timers, and by that I mean you and me now, as a community, and not just one by one, like I did when I was a nurse at the hospital. So, and we also have the opportunity to lay the groundwork so that those that age, that grow old after us, really do have, can live here as long as they wish and have the best quality of life that's possible for them. So I want to thank you for being here, and thank you for participating in the future at whatever level meets your needs, and thank you very much.
Thanks, Liz. It's definitely easy to see that when the stars align, how Senior Services decided to pick up the mantle on this one. The data is incredible. As Marty mentioned earlier, beginning of July last year, with the community input, we defined the important segments and the gaps in service and began to build a comprehensive plan for the future. Debbie Fallander, consultant with the Executive Service Corps, will highlight the framework of the plan and giving examples of specific elements included in each category. Debbie?